Well, thank you for coming back. And today we're talking to Dr. Michael Cohen. And I believe, Dr. Cohen, you are in Israel, in Tel Aviv, is it at the moment?
That's right. I'm in Tel Aviv. I work here as a GP.
And I'm in nice, wintry, cold Carlisle in the north of England. And my name's John Campbell. So thank you very much for coming on. Now, why should people watch this video, Michael? What we're going to talk about?
Well, I think we should talk about the role of vitamin D and perhaps any other preventative treatments for COVID. I had COVID myself in February 2020 at a time when it wasn't even known to be in Israel.
Yeah.
I didn't know myself that I had it. I thought I just had a bacterial pneumonia, and I treated myself. I did an X-ray, I did blood tests. I started myself on an antibiotic, and I was a lot better within 24 hours. I then thought, oh well, that wasn't very much. And then a couple of weeks later, I started having choking episodes in the middle of the night, and a lot of other symptoms that I developed over the next few months. And I'm a pretty fit person. I swim every day. And I noticed that my fitness was dramatically reduced, and I was having fast heart rate and stuff like this. And I literally didn't sleep properly for months because of the coughs, choking. Developed a neuritis in one of my arms. It's an inflammation of the nerves, which is extremely painful.
Is it like a pins and needles, or like a toothache feel, or?
It's more. It's like a dull but very severe pain that just is there most of the time.
Was that in your left arm or your right arm?
It was in my left arm. Why'd you ask?
Well, it's just I just find it so disconcerting when I get pains in my left arm.
Oh no, because you worry about your heart.
Associated with hearts, don't we? It's
no. This was definitely not a heart-related pain. But luckily, it was in my left arm because I'm right-handed. If it had been in my right hand, I would have had a really difficult time of it.
Sure.
And during that time, I actually treated myself with a number of vitamins, intravenous vitamins. I even used hydroxychloroquine at one point, which did help a lot. And I eventually got through it, but around that time I noticed the patterns of COVID in the world, what was actually going on, and also people with darker skin. Also in the UK, you had people in ethnic minorities, who you had doctors dying in quite significant numbers.
Absolutely.
And I just started to wonder, was this because they were working indoors, no sunshine, dark skin, likely to be vitamin D deficient, and in a place like Israel at the time, certainly, and also if you look at the global map, if you look at the latitudes, I can't remember, I think it's 35-degree latitude or 37. Countries that were within that, close to the equator, seemed to be doing a lot better. And so I started taking high doses of vitamin D, and I also told my entire patient population to do the same thing. I was telling them on an individual basis. And it's not enough to go by scientifically, but I have well over 1,500, close to 2,000 patients easily who come to my clinic, if not a lot more than that. And as many of them as possible, I told to take vitamin D, and I keep telling them, I keep reinforcing it. And I tell them what dose to take. I tell them to take vitamin K2, and I also tell them to take zinc. And then I tell them to up the dose of zinc if they actually develop any viral symptoms, and I tell them what to do. And what I can say is I've had quite a few patients with COVID, as would be expected. And I've probably had a handful who ended up getting to the emergency department and then being sent home with some kind of a treatment plan. I've not had a single patient admitted into hospital, let alone be on an intensive care unit. Now, I don't know what that means, but there were studies that came out soon afterwards. Around a year ago, there was a study in Israel in one of the hospitals which showed that people who were getting very sick were deficient in vitamin D, and people who had high levels of vitamin D were not getting very sick. And if you read a lot of the research, even though it's said that that there's no treatment for COVID other than monoclonal antibodies, etc., etc., it seems to me like we are missing on a very important point here. And I think the whole point of COVID was, from a medical standpoint, was we were told that that all of our efforts are supposed to be there to prevent the hospitals being swamped, to prevent the ICU beds being blocked. We don't have enough ventilators. We don't have enough staff. We want to protect the NHS. We want to protect every health system that we can. And yet what was actually happening was people were being sent home and just told, if your lips go blue, call us again. Or if, that was it. There was no there was no plan even for treating, let alone, a milder case.
Yeah.
And I wanted to talk about that basically, because in my humble opinion, this pandemic doesn't need to be anything like what it is.
I don't think your opinion's that humble, actually, Doctor, because you're trained as a general practitioner in the UK and in Israel. You've got a lot of surgical training and a lot of accident and emergency training as well. So you've got a pretty good body of medical knowledge, and you're also very interested in preventative healthcare, I think, aren't you? That how disease can be prevented. So the dose of vitamin D, what sort of doses are you thinking about, and do you like to titrate it up to a particular level, or how do you approach that?
First of all, it should be noted that a lot of people are initially resistant when I mention this to them. I tell them, look, this is not strictly only a vitamin, it's actually a hormone. It's a steroid hormone. It has a lot of effects on the body at different doses. There are estimations whereby at doses of around 5 to 10,000 units a day, it's interacting with switching on and switching off up to 1,200 genes in the body, and at lower doses, lower numbers. It's known to be extremely safe, even at what are called high doses. There have been studies that have shown that taking 50,000 units a day for 6 months has had no adverse effects. I usually tell people to take 4,000 units if they're normal adult, but I also test many people's vitamin D levels. And even in Israel, where it's sunny and people have quite a bit of exposure to the sun, I find quite a lot of people who've got low levels of vitamin D, so below 20, some people even below 10. The ideal dose to get them to would be between 50 and 100 nanograms per milliliter.
So this is nanograms per millimeter.
Per milliliter, yeah.
Yeah. So in terms of nanograms per mil, that would be like 2.5 times that, wouldn't it? Be a lot higher.
Yeah.
It's the way it works out. Yeah. So 50 to 100 nanograms per mil. That's right. That is a very interesting piece of information. Thank you. Yeah.
And I can say that I don't know if I'm reiterating here, but I've literally not had one person admitted into the hospital yet. They've all ended up coming back home from the emergency department. Now, my population does consist of both young and old. It's more skewed towards young and middle age for sure. But again, the fact that people were not even being admitted into hospital in my population, it says something. It's not the whole picture by any means, and I'm not trying to tell anybody that this is the cure-all for COVID. But if everybody was doing this, would we have anything like the current so-called justification for turning this into a global crisis?
Yes. I mean, in a population of 2,000 people, given the very high prevalence there has been of COVID in Israel, I mean, I would suspect probably at least 3/4 of your patients have been exposed to the virus, probably even more than that, but probably 90% actually have been exposed. And you would have expected 1, 2, or 3% of those potentially to be hospitalized. So the fact that none have, As you say, we can't extrapolate that from that to the whole world, but that is actually, if we actually did a statistically, if we did like a t-test on that and compared your population to the population, say in Jerusalem or Damascus or somewhere that weren't getting the vitamin D, I'm sure we would find a statistically significant difference between those.
Yeah, I mean, I honestly don't know. I don't want to make any specific claims. What I can say is that the concoction of things that I've told people to take are extremely safe. I mean, far safer than most other medications that I can think of. And I'm not at all saying that they shouldn't get vaccinated. I'm not saying they shouldn't get other treatments if needed. But as a first line of defense, we should be dealing with people's immune systems in the safest way possible. Now, we know that 25 milligrams a day of zinc is extremely safe. You can take up to 40 milligrams a day without any ill effects for most adults. Going above that, it can reduce the absorption of copper, so it's not a good idea to take that on a long-term basis. Vitamin D, you asked me what dose, so most people, I tell them 4,000 units, but people who are overweight, they may need up to 8,000 or even 10,000 units or more per day. And the other thing I tell them to take is vitamin K2, 200 micrograms a day every day as well, because vitamin D does cause the release of calcium from the bones into the blood, and you want to try and avoid any deposition of that in the wrong places. And that's it, basically. And obviously, the other things like getting enough sleep, getting outside, doing sports. It's very much about looking after yourself. But my concern is that all the focus has gone into putting the burden on the hospitals and even outpatient care. And we need to be doing everything that we can to prevent this becoming a severe illness.
And a lot of the focus has gone on to like high-tech, very clever preventative treatments, like these vaccines,
and expensive.
And expensive. But I mean, these vaccines are completely brilliant. I mean, we've invented mRNA vaccines and adenovirus vector vaccines. It really is clever stuff.
It's remarkable.
But you know, why have expensive, clever things if we could use the simple things as well as?
Yeah, but I mean, I would still say we've got over half of the world that's not been vaccinated yet.
Yes.
What are we doing for them? Why wait?
Indeed, yeah. So what's really struck me there is I've only been to Israel for a short period of time, but I remember it was pretty hot and sunny. So if people are short of vitamin D in Israel, what must it be like in the north of England, in Chicago, in Canada? Our levels must be right down in our boots.
But the other thing to say is that the definition of what is a normal vitamin D is questionable in this situation, because one would normally say that someone's supposed to have above 32 nanograms per milliliter. But it seems from the studies that I've read that to have the best protection possible for COVID and probably for other viral infections, including the flu, you would want to have a level above 50. Now, even if they get to 30 or 32, it's got to do something, perhaps not as much. But I really, it's a cheap vitamin. There's pretty much no side effects of this, and it can do a lot.
It is interesting, isn't it? The way that we need a relatively low dose to prevent the classic vitamin D deficiency disease of the 19th century rickets. And then but then slightly higher dose does a bit more, and a slightly higher dose does a bit more, and a slightly higher dose does everything that triggers all the genes and the protein pathways that actually need vitamin D as part of its sort of enzymic activities. It's amazing how much vitamin D is just vitamin D receptors are just rooted in so many human physiological systems.
Virtually every cell, from what I know. They're on virtually every cell. So it does suggest that they have a purpose, and a lot of it is immunomodulatory. So they're actually directing the immune system to work in a better way. If you combine that with zinc as well, which we also know has quite significant effects on viral infections and the ability for cells to kill viral infections, I think that there's really little to say don't take this concoction.
So do you think zinc is immunomodulatory as well, or do you think it's just that a lack of zinc will cause immunodeficiency?
I don't know the answer to that. And I have read stuff, and it's purely my memory that's failing me at the moment to say exactly what the reason is. But zinc, for example,
it goes to prove this interview wasn't rehearsed. This is us as we are. Yeah.
I didn't know I was being interviewed.
Sorry about
that. I can say one thing. I can give one example would be hydroxychloroquine. So the drug that was derided at a very early stage.
Yeah.
It seems that if you want that to work better, you give it with zinc. It seems to make the difference. You certainly don't want to have a situation of a zinc deficiency. And it is known, I have read quite a few bits of research that show that zinc does improve the immune response to viral infections. And I can say anecdotally, I use it on a daily basis in my practice for regular viral infections. And quite often I tell people, as soon as they get a virus, just take 50 milligrams of zinc twice a day. And they do it for a week, and it knocks the virus on the head within hours sometimes.
That is amazing. I mean, we're assuming there's two things there. The hydroxychloroquine kind of gates the zinc into the cell, doesn't it?
Yeah.
And we know that these so vital T cells, these T cytotoxic lymphocytes, need zinc to function normally. Absolutely. And without T cytotoxic lymphocytes, viral infections just go
viral killing otherwise.
Yeah, that's right. It's going to absolutely run riot. Now, that is interesting. So patients with viral infections, we're under the impression that they get an immediate benefit from bolstering their zinc, almost like it's working straight away.
That's what it seems to me. I don't know if you've ever tried it when you become ill, but it can work very, very quickly.
That is so interesting. Whereas the vitamin D, my understanding with vitamin D, it needs to be metabolized, doesn't it?
It does, and you need at least a few days of it beforehand, and therefore I tell people to just take it constantly. But to get good levels, you want to be taking it for at least a few weeks beforehand. And seeing as you don't know when you're going to get COVID, and you could get COVID twice easily, I've seen many people who've had COVID twice. It's important to be taking it throughout.
Yeah.
You can't, and if you wait until you actually get the virus, it's already too late. Even people who've received high doses, they've done studies with 50,000, even 200,000 units of vitamin D given as a shot at the time of admission to hospital. It probably does have some immunomodulatory effect, but it takes time for it to kick in. It takes at least a few days, by which stage the person could be a lot further down the illness with COVID. They could be onto a much later stage of COVID whereby they're already ventilated. And the whole idea of this is to prevent that.
Yes, absolutely. We know it has to be metabolized by the liver and has to be metabolized by the kidneys. And I can remember, patients with renal failure, for example, who couldn't metabolize their vitamin D before we could compensate for this, and they had a lot of bony loss and all sorts of problems. So it does take that amount of.
I mean, that's just the part for it to be metabolized. After metabolism, you've then got to make sure that it actually has its effects on the genetics of the body, on the immune system, and that presumably takes longer.
Interesting. So part of the way this is working is it's switching genes on.
It's switching genes on, it's switching genes off. But ultimately, these things take time. It's like when you take any long-term medication or vitamin, people often say this doesn't work, but if you give it enough time, cells themselves go through processes of being born and dying, and the body is constantly reproducing new cells and killing off the old cells. So for some things to see an effect, you need to wait for the old ones to move along and the new ones to take effect. It's not like you're just going to get everything happening overnight the moment you've got a drug in the body.
I think that's an excellent point, isn't it? It's like if someone's very iron deficient and you start giving them iron and you do a blood slide 6 weeks later, half of the red cells are tiny little anemic things and the other half are nice big proper ones. It's the new generation of cells that gets the benefit from that.
Yeah, don't get me started on iron.
I certainly will, but on another occasion. Yeah. Why do people that are obese need higher doses of vitamin D?
It seems like the fat cells, the adipose tissue, I'm not sure if it's just in the gut or elsewhere, well, seems to store vitamin D, but not to use vitamin D. It's not, I can't, again, I've read the mechanisms of that, but I can't say exactly why, but they don't reach the same plasma level of vitamin D, not at all. So people being told to take even 4,000 units, check their bloods, and their vitamin D is hardly shifted. And I've got some patients who are on 12,000 units a day, and that's what gets them up into the sort of 40 to 50 range bracket. Yeah, I don't know if that answers your question.
Yeah, I think it does. I mean, we learn, you know, probably at school that the fat soluble vitamins are A, D, E, and K, didn't we? And that they can go into they can go into the fatty tissues. Now, I'm very interested in that you're advising K2 as well, which makes perfect sense. My understanding is that the K2 would only really be necessary if you're taking quite high doses of vitamin D, because you'd need quite high doses of vitamin D to liberate enough calcium into the blood to even be a risk of hypercalcemia. Is my thinking need developed on that, do you think?
I think your thinking is correct, but from what I can tell from what I've read, you need at least 100 micrograms a day if you're taking 4,000 units of vitamin D. And seeing as many people don't get levels of 50 even with 4,000, they often need 6,000 or 7,000 or 8,000 units a day. I tell people to take 200 once they're going above 4,000. But yeah, 100 is supposed to be enough when you're taking 4,000 units. If you're only taking 1,000 or 2,000 units, you probably don't need vitamin K2.
Right. Okay, that's interesting. Now, I'm actually the tablets, the capsules I've got of vitamin K2 are actually 600 microgram ones. So, okay, is it okay to take one or two a week instead of one a day?
I actually don't know the answer. I've also never seen them sold as 600 micrograms. I've only ever seen the 100 and the 200. So, I'll slow release or anything like that.
Yeah, I looked at the 100 and 200, and the 600s were the same price, so I bought the 600. But I mean, I think if it's fat soluble, it is going to be stored in the body for a period of time.
It should be okay. You look like you're a good normal weight, so I imagine that. Fine.
It's remarkably kind of you to say so, but I can assure you it's not the case. So it's so simple. The thing that really strikes me about vitamin D and vitamin K2, it's, you know, obviously you've talked about the medical reasons for it, but there's kind of philosophical reasons here, isn't there? I mean, you know, when people migrated north from the Middle East and Africa, we had dark skins, and then the selective pressure to become white. Yeah. I mean, I only know of two that the skin produces more vitamin D when you're white, and I think it produces more nitric oxide, that keeps the blood.
That I don't.
But the vitamin D is the big one, so that's a big evolutionary pressure, because basically I think humans are kind of hunter-gatherers, aren't they?
Well, this is what we're led to believe. Yes, if we read.
Yes, we could spend a lot of time arguing about that. Yeah. But or I think it's quite reasonable to say human beings are designed to survive. That could be another way to.
Yes,
that could be another way to look at it. And the other thing is, living in a simple situation, we would be eating animal products, and the animals would be fed on grass. And of course, the vitamin K2 is made by bacterial activities in the animal's guts. So mass-produced farming, the meat and the milk will have low levels of vitamin K, whereas in the natural K2, whereas in the natural situation there'd be high levels of K2. And of course, from fermented foods as well, I guess it would be normal to store foods for fermentation as well.
Yes.
As happens in Japan, for example. Yeah. So, is this? Do you think that these measures, the vitamin D, the K2, and the zinc, is this going to work against a range of viral infections or a range of bacterial infections, or what do you think?
I don't know the answer to that, but I expect that yes. I certainly think that in general, one should maintain good levels of vitamin D throughout the year. And not just in the winter. There's always this emphasis that, oh, it's the winter time, this is when you need lots of vitamin D, and the rest of the year, well, we'll just ignore it. We've got enough sunshine. I can tell you that I swim 1 kilometer every day in the sun for nearly the whole year. And I don't reach these levels of vitamin D without taking a supplement.
That is just so interesting. And if you're in the Israeli situation and you're not getting enough, then yeah, that speaks a lot. So if you've got dark-colored skin and you're living in Sweden, you've got basically no chance at all. I mean, it does make sense if it's, well, there is actually evidence that vitamin D does protect against influenza. I have read that specifically. But if it's optimizing the immune system, and the immune system is what combats viruses, bacteria, protozoa, all the infections, really, it would make perfect sense that.
Right. I mean, the way I see it also, if you look at a lot of studies in general, especially when it comes to do certain vitamins help certain problems, if you actually look at the doses that are given a lot of the time, you're talking about quite minuscule doses. I mean, vitamin D sounds like a large dose. When I tell my patients to take 2,000 units or 3,000 or 4,000 units, they say, well, wow, it's a large dose. But actually, these are not large doses. If you actually titrate them to the levels that they get to in the body, then they're not very large doses. And the fact that these are guidelines, and even I think all government guidelines would say that up to 4,000 units a day is perfectly safe. The fact that people are actually encouraged to take 1,000, 2,000 during the winter, it seems to me inadequate. And therefore you're setting yourself up to fail.
And if you think that 1,000 units is only 25 micrograms, and there's 1,000 micrograms in a milligram, and there's 1,000 milligrams in a gram.
These are tiny. When it's put into the international units, it's made to sound like some huge whopping dose, but it's really not.
And I think that roughly, tell me what your thinking is on this. If you and I go outside in the sun in our shorts and we have, and it's fairly sunny, we have a reasonable sun exposure, not well short of being sunburned, I would imagine we're probably making about 20,000 units in that hour or two. Does that sound?
I've read about this as well. I can't remember the exact amount that we're thought to make. And again, it will depend on the color of your skin. It will depend on your age, because as we age, our skin's ability to produce vitamin D drops dramatically.
Dramatically? Interesting. I knew it dropped, right.
It does drop. From the studies that I've read, yes, it drops pretty significantly. It's not a small thing. The fact that you have older people who don't reach good levels, actually at a time in their life when they probably need to have good levels, is also something. I think the point about this is that we shouldn't be relying on outdoor exposure to get enough vitamin D. We should still have outdoor exposure, but it's not enough to rely on it.
And I'm just so reminded now of the two tragedies that you mentioned, that doctors dying earlier on the pandemic, and in the UK, a lot of doctors who were working heroically and who happened to have darker coloured skin died through COVID. It's just absolutely terrible. Then, of course,
it made a lot of sense that was, I mean, as sad as that is, it made a lot of sense that vitamin D is likely to be implicated in this. If you've got people who are working indoors for long hours, not seeing sun probably most of the time, and even if they were, they've got darker skin in higher latitude country. This is not so surprising. If vitamin D is implicated to this extent, then everybody should be on it. I mean, especially healthcare workers, but really the whole population, including children.
Yes. And the other group, of course, were people in care facilities that particularly died disproportionately. It's an easy to say, oh, well, they were older, they had more comorbidities.
They also had they also have a higher chance of having a much higher viral load at the point of contact with COVID. They're going to be, if they're going to be exposed to more and more people at close quarters, then they have a much higher chance that they're going to get a high viral load at the instant when they catch it, and then they're more likely to become much more ill. And so it's just another factor in that. Again, having vitamin D, having zinc on board, these things I'm not saying that they're going to cure everything, but really the whole purpose of our focus was to prevent hospitalizations, was to prevent the NHS collapsing, to prevent all the health systems collapsing. And what was actually done in an active sense, other than social distancing and wearing masks, in going into isolation, these are important to some extent, but it's not enough. The person has an immune system, and what are we doing for their immune system?
Absolutely. I mean, medicine can only ever be an adjunct to what your physiology wants to do normally, can't it? So, yeah. So we've mentioned vitamin D and immunity. Do you think vitamin D is important for anything else in health?
Well, apart from the fact that it's the key vitamin in preventing rickets, so which we all know. Is it important for anything else? It probably is. There are a lot of studies. A lot of them, I don't know how many studies have actually come up with meaningful results, but there are a lot of studies suggesting that it might be important in, I think, heart disease, cancers, all sorts. And again, I've never read anything that suggests that it's even mildly toxic if given in a reasonable range.
It's something that's just occurred to me. You've said this can affect 1,200 genes, 1,200 genes. And one of the amazing things that came out of the Human Genome Project just a few years ago was that there's probably only about 21,000 active genes in human beings.
Right.
So what we're saying is that 5, 6, 7% of our genes are actually vitamin D dependent for their action.
I can't say I know enough of the science to say anything more than that. I certainly wouldn't want to make any ridiculous claims, but that's already a large number of genes.
Yeah, it is, absolutely.
You just look at the absolute number instead of as a percentage. It's a large number of genes to be affected by one molecule.
No, I think that your patient group does constitute a cohort, most definitely. It's a fascinating finding, and when you've done medicine for a long time, like you have, you can you do get a feel for what's working, I think, don't you? You see it in patient after patient after patient. Yeah. You do kind of get a gut feel for it, and that's kind of consistent. When that's consistent with the science. Yeah,
exactly. And when you're not seeing side effects, when you're not seeing any problems, when it's a dirt cheap thing to take. It sure really doesn't require much mental effort.
And so many drugs and treatments we use. We have this term, don't we, called iatrogenesis, that the harm that can be done by treatments, the harm that can be done by surgery, and they are quite significant. The side effects to all of the medications. Of course, the whole debate now about the side effects from the vaccines that we're using now, which is
in terms of the vaccines, number one, I'm very much for vaccinating, but I'm not sure that everybody needs to be vaccinated in the way it's now going down to children and to young children. I'm not entirely sure what the rationale is for that or the safety. I certainly think that people at high risk should be vaccinated of all ages. And I think there needs to be a strategy for this, of course. Again, even with the vaccination, I think it's prudent to give someone vitamin D beforehand and after. I see some pretty severe side effects from some vaccinations that have occurred. Really quite severe side effects. Luckily, I haven't seen anybody die as a result of the vaccine, but I have seen people have horrible neurological effects going on for months, and I think slowly improving. But I've got some patients who are even a year on. This is not from the vaccine, sorry, this is from COVID, but I've also seen similar things with the vaccine. And so I think it would be prudent for them to be getting vitamin D, partly because the vaccines are thought to work even better, and partly because both vitamin D and zinc may improve the person's response to the vaccine in such a way that perhaps they won't have such serious side effects. That I can't say for any certainty, but I don't see the harm in it, that's for sure.
It makes perfect sense because a vaccine is essentially an antigenic challenge, isn't it?
Yeah.
Just the same as being exposed to a virus is an antigenic challenge. And If we know that these vitamin D receptors are in, we believe, all the cells of the immune system, it's pretty inconceivable to think that vitamin D couldn't have an effect. Is this catching on in your medical colleagues in Israel and the UK indeed?
I think it's a bit divided, to be honest. Not so much because anyone's given it really that much thought. I think the usual response, and I can say this myself as a medical doctor, who I've been practicing now for 20, close on to 25 years, and I can say that certainly in the beginning of that time, if someone had spoken to me about vitamins and their use in health, you'd probably be considered a little bit, how to say this?
Alternative.
A little bit alternative, yes.
Yeah.
And I think that may be the case for many things, and there are certainly research studies that show that certain vitamins may actually cause harms rather than good.
Yeah, sure.
But I think each thing on its own, and you have to look at the actual situation. In the event of COVID, you have a worldwide pandemic with a virus that's mutating with unknown effects in the beginning and quite a large range of potentially quite severe effects for many people, and no useful treatment for it, or treatments that are extremely expensive, and not much of an initial strategy other than just go home and then come back if you get a lot more sick.
Yeah.
It's about taking the wider picture, that's all, and about being sensible.
Yeah, and I like the way this fits into your whole philosophy of preventative healthcare.
I mean, if we're not doing that, then what are we doing?
Well, treating people when we get sick, we are reactive rather than proactive.
Right, but we know so much more today that we can do.
Sure.
Then why are we not doing it?
Well, my hope is that this will get the message out to at least a small part of the world. We'll get a few people thinking about it. Talk to your own doctor, of course. We can't prescribe for you. We don't know you as an individual, but certainly encourage people to get their vitamin D levels checked and to consider the possibility of vitamin D deficiency and vitamin K2 and zinc as well. These are such common things. I
mean, the vitamin D blood test is not cheap, and so health services are reluctant probably to use it on patients. But there are clear guidelines of safety with vitamin D that any doctor knows, and you don't have to have a blood test, and even if you don't get tested, and even if you don't know what level you reach, taking these sorts of doses, 2,000, 3,000, 4,000 units a day in an adult, they're not going to harm, and they're not going to cause any toxicity. Even much higher doses wouldn't. And
it's going to be better than it was when you were deficient.
Exactly. And even if you're not deficient, even if you had a normal level, then raising it a bit further, again, it's not going to harm you.
Excellent point. Excellent point, because not all the world has access to these expensive high-tech options, whereas vitamin D is generic, vitamin K2 is generic, zinc is generic. It costs. I get all mine from the supermarket.
Right.
It's Dr. Michael Cohen. That is fascinating. Thank you for giving up your Saturday afternoon for us, and
thank you for all of the time that you invest in your lectures.
Not at all. Just tell us how you are personally after your COVID. It took a good few months, but you're fully recovered now, or?
Yeah. I mean, it took me about probably close to 7 months to fully recover.
That's a long time.
I could see the progress of it, because if you're swimming every day, you can see how you're actually doing. But for me, it was actually an interesting learning experience, I'm able to translate a lot of that into how I treat my patients. I can, to some degree, anticipate things. Sometimes you can literally smell when someone's come and there's odd symptoms, and you start asking them more questions because their tests come back normal. You say, well, okay, well, when was that? When was your vaccination? They tell you vaccine, then the appearance of these incredibly unusual symptoms, neurological symptoms that seem to have come out of absolutely nowhere in an otherwise fit and healthy person. I even read a recent article on one of the online medical journals saying how, this was the problem with fitness, for example, was due to deconditioning. So as though someone hadn't been doing sport because they were unwell. But it doesn't then explain how, when they received the second dose of the vaccine, they immediately went downhill again with their fitness in an otherwise fit and sporty individual.
That's right.
So there's a lot of questions around all of this, and I honestly think that keeping to the basics first, keeping good nutrition, good sleep, staying active, and a couple of these vitamins is not going to harm anyone and is very likely to help a lot of people.
And then worry about the clever things after that.
You've still got the clever things. You need the clever things.
Yeah, of course you do. Yeah.
You don't need them for as many people as frequently.
Yeah, absolutely. Medicine is for the sick. Yeah.
Yes.
Yeah, Doctor, thank you so much for that. Absolutely fascinating. I'm sure there'll be lots of comments if you want to read through and answer a few of them. I'm sure people will be delighted to hear from you. And
how to do that later.
Yeah. So thank you very much for your Saturday afternoon. We really appreciate it. And I would love to talk again at some time. Maybe we could mention iron and other things.
By all means.
Yeah. Thank you.
Okay.
Thanks,
Take care.
So thank you.